Lining the news recently, there's an increased use of prescription ADHD meds in preschoolers. Seems a little young. Dr. Jared Skowron's a naturopathic physician and the author of the best-selling book 100 Natural Remedies for Your Child. He's here to weigh in on this. I tell you, when I heard this, I thought, gee,
It's shocking. The numbers are just going up and up and up. And I think what scared everybody in this recent CDC publication was that they broke it down by age. And so now we're looking at preschoolers, ages 4 and 5, and 50% of them with an ADHD diagnosis are on drugs.
How do we fare here in Connecticut? How are our children, where do they stand on this?
Well, when it comes to the prescriptive medications, we're about average. I think we're 23rd or 24th in the nation. Where we're better is the amount of behavioral therapy. And the American Academy of Pediatrics really suggests behavioral therapy before drug therapy, especially in these young kids. And I believe we're number 11th in the country for behavioral therapy. So we're kind of ahead of the curve when you look at the whole nation. But the side effects of those drugs are really problematic.
Which we want to talk about. First, what exactly would be behavioral therapy when it comes to this before jumping into the drugs?
Well, there's different therapies that are available at school or birth to 3 programs right before preschool. So we're looking at occupational therapy, we're looking at speech therapy, we're looking at physical therapy, and we're looking at behavioral therapists that just help train kids to be in school and listen to the teacher and follow directions.
You touched on a couple things. I want to talk about the side effects of these drugs, and then also let's touch on the fact that there is pressure from teachers and schools in some instances to get these kids on them. So first of all, what might be some side effects associated?
Well, there's a fair number of minor side effects, but the big side effects that don't occur often but are really concerning affect the heart. So you've got stimulant medications that can affect the heart, and really anybody put on these stimulant meds should have periodic EKGs. So to think of
toddlers,
you're looking at a 4-year-old having an EKG to make sure that their heart isn't affected. It also can suppress the appetite and therefore suppress the growth if these kids are on these meds long term, and that's really scary.
That's a really serious thing to think about. But there is pressure. Some parents will say, there was pressure from the teacher. They didn't want my child to be disruptive, so they're suggesting try this ADHD medication before you bring them back to class. You can understand the frustration of a teacher not being able to get through their curriculum, but at the same time, you just talked about some pretty severe side effects there.
There are, and a lot of my patients are concerned because the school systems and the teachers are pressuring them to have their child behave better. And a lot of people just know that the only thing around in their mindset might be drugs, but in actuality, the behavioral therapies are suggested first by the pediatricians and are usually more effective.
Let's talk about the natural way to look at this, because that's where you come in, and I'd love to know how these delicious looking, what are these, eclairs or something?
These are St. Joseph Day Zabalas.
Oh man, oh man.
The CDC even looked at the number of kids taking dietary supplements for ADHD, and that was about 10% across the board. So while it's not recommended by the American Academy of Pediatricians, there's a lot of parents doing it. So the first thing we need to look at is diet.
What they're eating.
Kids need to cut down the sugar, like these delicious Zapalas from the other day. Also need to cut down on artificial food colorings, which are outlawed in Europe because they cause hyperactivity, but they're allowed here in the States.
So these not so much for your preschoolers, but the newsroom would be happy to test.
This is what I'm saying.
Do you want to test them on us?
I think we should. Let's see if Bob gets hyperactive.
We're hyper anyway. This will wake you up, Bob. Forget the 12th cup of coffee.
And
all right,
of course,
what about some supplements?
There's great natural supplements that help calm kids down, and especially kids who aren't eating a lot of fruits and vegetables. There's important minerals like magnesium and zinc that can relax the body. Fish oil has been studied for over a decade to help with ADHD and hyperactivity, so there's a lot of things that we can do with behavioral therapy, natural supplements, a better diet before we need to get into the drugs.
Certainly sounds like the behavioral and the dietary. These are serious conversations parents need to have, like you say, before we jump into the drugs. And in some extreme cases, perhaps the drugs are the only way to go. But it sounds like maybe a couple of avenues to exhaust first.
Exactly.
Yeah. All right, Dr. Jared Skowron,
thanks
so much.
Good to see you.
Appreciate it. If you want more information, you can get it. You can head to SpectrumAwakening.com. All right, just ahead, more spring showers. It's kind of gloomy out there. We're going to talk to Bob.